Yes, sir. It is World Cancer Day, and today we are reminded that we can all help in the fight against cancer through education and awareness. Now, there are various types of avenues when it comes to cancer treatment that are available, and among them, homeopathy, which is one of the most common complementary therapies used by people with cancer, offering a completely different type of treatment than conventional medication, and of course, focusing on the natural medicines that stimulate the body's own healing ability to restore health. But the question is, just how effective is it? And that's why we brought in the expert homeopathic doctor, Dr. Benjamin Hur, to answer those questions. It's good to have you here, sir.
Thanks so much for having me.
Fantastic.
Doctor, thank you so much for joining us. I know we're talking about a very big thing, some big questions here, but maybe you can demystify it. How do we use homeopathy in the treatment of cancer, if you can simplify that for us?
Sure. Well, the approach that homeopathic medicine uses in the treatment of cancer is very specialized and very individualized. The key is not only to have a diagnosis of cancer, but also to understand the characteristic and unique issues that a patient would present with. So we might have two patients presenting with the same cancer diagnostically, but very different symptoms in their presentation. I'll give you an example. So a patient with prostatic cancer, T2 grading, might suffer from difficulty passing urine and paralysis of the bladder. We might utilize a medicine known as Connea maculatum. Same diagnosis, prostatic cancer T2, for another patient presenting with frequency urinating and pain and burning on urination would require a different medicine known as occidentalis. So in the individualization of treatment is the focus of how homeopathic medicine treats.
And speaking of the treatment, how effective is it?
So the efficacy of homeopathic medicine is determined by a number of factors. Obviously, the pre-existing conditions which may have been there before the diagnosis was made, any other family history, and any medicines that have been utilized since the diagnosis all play a role in the efficacy of the homeopathic outcome. With a large repertoire of very effective medicines that have been used for over 200 years, if you were to find out and assess the research that is currently available, most of conventional medical research at the moment is largely inconclusive. And this is specifically because the methodology used in researching homeopathic medicine is very specialized. But we do have extensive literature over the past 200 years demonstrating very positive results.
Okay. Why should it not be used alone, or should it be used alone or in conjunction with other medicines? What message are you trying to send?
Yeah, basically, each case needs to be weighed up in its own merits. There are purely surgical cases which require most assuredly a surgical intervention, and others which require chemo and radiation treatment. Homeopathic medicine can be very effectively used in conjunction to maximize therapeutic outcome, minimize side effects, and increase overall survival rate. There have been some positive studies which have demonstrated a significant improvement in survival rate when homeopathic medicine is used in conjunction.
Yeah. Now, of course, we do know that most cancers do present an inflammatory kind of condition, and that can be, apparently, you can correct me if I'm wrong, be treated with buchu, which is a plant that is grown right here in the Western Cape in South Africa. And what other homeopathic treatments or medications are there?
So inflammation plays a very significant role in many chronic conditions, and cancer most significantly. Treating inflammation will obviously have a very positive outcome in some of the symptoms and effects that are experienced during cancer, but will not necessarily cure the cancer itself. So utilizing something like buchu will benefit the patient, but curatively one has to assess each case in its own merits. There are a number of other medicines which we utilize. I mentioned occidentalis earlier. That can be also employed in things like uterine cancer. We use another medicine known as Hydrastis canadensis, which would be effective in things like breast cancer and stomach cancer. And each one of these needs to be utilized effectively on an individualized prescription.
Yeah, Doctor. Thank you very much. Yeah.
Thank you so much. Hugely interesting. I think through homeopathy, it may be used alongside conventional medicine. It should not be used in place of conventional cancer treatment. We advise that you still consult with your medical doctor. As Dr. Hur has said, every case is very individual. We'd love to hear your thoughts on the subject matter.
Absolutely. Here's what you can expect on your Feel Good Breakfast show. Leanne's got the details.